Nice. What are we talking about today?
What we use to look at for injury evaluation, like after we defined what it is, how we decide what we need or what we got to do or what you want to do.
Neil, do you have a
So
way of simplifying everything? How do we
simplifying what,
how do
like
we
if
simplify our process to where we can take all these numbers and tests and whatever we find and turn it into something that's something we can kind of jump into action because we don't have a lot of time when it comes to okay, I'm hurting here. We don't have a lot of time to go sit down at our desks and look at everything and have a bunch of time to draw something out. It's kind of like you got to go on the fly. So the more you can simplify it, the easier it's going to be.
yeah, exactly. And so like for me, there's at least a couple tests I'll look for that can guide me right away, regardless of kind of what the injury is. It at least tells me what kind of position the person should be in, or maybe kind of where to start. Appendage wise, like where to put some things. Um, but it is hard, like for me to decide whether okay, is it definitely a strength? Is it definitely a stability? Like you look at all the numbers, and like you were going back to saying, and like using the chessboard of getting left versus right IR ER both hips shoulders. Like there's a lot of numbers you can use. So kind of like what if you have time one on one. Yes, I think that's good to do and to kind of keep next to you. But if you're at the affiliate, for instance, or you just if it's office, it's not the first eval where you have 45 minutes to work with the guy, then you kind of got to go like what are your big rocks? So I guess my before I get into my thoughts, what are your big rocks? So if someone comes in, low back pain, shoulder pain, it doesn't matter. I guess after you determine what you think it is, so you can call back to your coordinator or whoever and say, yes, that's what we got. What do you do to decide where to start your treatment?
I'll try and look globally and see how I can use global approaches. So if it is like a shoulder issue, and if you, for the sake of making it easier to talk about, if it's a cuff, do you hear that right now? I think a car is exploding down there. Anyway, um, so if it's a cuff pathology, I'm going to look at what provokes pain. I'm not going to try and push them into that position, but I'm going to try and get them comfortable moving into that position eventually. I'm going to try and figure out what joints interact with that joint. So if it's shoulder, you got to look scap, you got to look ribs, and then eventually it's going to make its way to spine, hips. I mean, you can keep going for a while, but I'm going to try and stay somewhat local, at least to start. And then when I can circle back, maybe the next day when I can kind of look at everything, I've looked at the numbers of what I got on my eval, then I can have a clearer picture of how I might want to attack it globally. But for that initial thing, I think it's kind of important to target that specific area and at least get some pain management and make that your win, because initially that's going to be the most flared up they're going to be is that initial eval more than likely. So I'm going to start there. I'm going to work through some ranges to where, again, exploring how much range do they have actively. I think that's particularly important. I'm going to not load them too much, but again, I want to see that they're comfortable firing in different positions, take them through concentric, eccentric, isometric, and that first initial treatment is almost like a working eval as well. I'm kind of seeing and noting how did they do in these initial phases, and then I can look back and say, okay, how was this compared to that first day? Because even that initial eval, it has to be a working thing to where you're always checking into it and seeing are they progressing and are you making some sort of change or are they making some sort of change?
Yeah. And like the favorite answer, it depends. It depends on, is this an acute injury? Has this been a chronic injury? Is something that the guy just needs something right now? Like, it doesn't seem like it's an issue, just kind of like maintenance. It depends where on the spectrum it lies. And so, just me personally, I'm geared more towards manual therapy, I'd say, to start.
Hmm.
That's probably due to sometimes it can create a super quick change.
Yeah.
And if we're a lack of time, that's huge, especially just being used to being the affiliates when you have 25 plus guys there and you only can sometimes deal with 5 to 10 minutes of time per person. You got to make as fast a change as possible. And I always like to throw in just sneaky evaluations while doing stuff. So
Hmm.
whether it's kind of feeling, so just a typical answer would be someone comes in with just to say like elbow soreness. In my mind, I have an idea, like you were saying about active versus passive, and what's the motion that bothers, and kind of what could be limiting factors of that motion. And so when you start correct or start feeling for those structures, at least you start feeling for tone. You can start feeling up to the elbow. I'll pronate and supinate the hand a little bit and kind of feel the form, see what moves, what doesn't move, what glides, what slides, what moves at the humerus, the bicep-ish area, and then kind of go up to the shoulder and see where that goes. Just sneak in some IR and ER motions as well, and just kind of see where they're at, and take someone through a full range, like we just alluded to. Um, and it's almost, for me, it almost seems like if it's a quick fix, if manual therapy doesn't work, then I move on to exercise. Or at least if the manual therapy does work, I'll back it up with something quick, some sort of quick exercise at least. But it really depends per person and per scenario. It's why it's kind of hard. It is hard to talk about what would you do in this scenario, though. Uh, I think the biggest thing is just like the process. And so it's a full eval. I think that's different than just a guy walking in requesting a little elbow love.